I'm going to first introduce you to our 5 judges who are members of the Strategic Advisory Board as follows. Helen Bevan, bravo, come on in. Fiona Moss, bravo. Young Lamar. And 2 guest judges, Don Berwick, bravo. And e-patient, Dave de Bronkhart. So, contestant number 3, Damien Rowland, is going to talk about simultaneous safety, purposeful physiologic detection. Over to you, Damien.
Good afternoon. Thank you for staying so long in the day. My name is Dr. Damien Rowland. I'm a paediatrician. So I have a task just for the Dragons audience. Don't help them here. They're big and ugly and clever enough to do this by themselves. Is that child well or unwell? That's a muttered well from the Dragons, not particularly confident about that one. Okay, so what about this one? Well or unwell? Okay, so they're a bit more responsive about that one. Okay, so this last one? Okay, so excellent, a bit more dynamism there. So, critical observation. So that was done without any help at all from physiology. It was done without any sound. But actually we know that heart rate, breathing rate, temperature, oxygen saturations, they are all consistently shown to help in the evaluation of both sick children and sick adults. We know around the world that we use these things, a saturations probe. You stick them on your finger, you get a little wave trace, and it gives you your oxygen saturations. Now the great thing is that the World Health Organization have linked up with something called Lifebox, and around the world at the moment there is a distribution network to get saturations probes which are affordable to everyone, okay? Because they are proven to have an effect, especially during surgery, but they are also useful in other health communities. And a SATS probe gives you your SATs, your oxygen levels, but also your heart rate. This paper came out nearly 10 years ago, okay, and it has been replicated again and again, and it says that you can use a pulse oximeter, what measures your oxygen saturations, to do your heart rate, but also your respiratory rate. Now, more than that, we also have papers saying that if you measure changes in the infrared spectrum and the temperature of the sweat, you can have a temperature analysis as well. So, this is something I prepared earlier, okay, and I'm going to come forward to show it to the judges. I spent a lot of time working on this, obviously, and I don't know if it's possible to show this to the audience, whether we can switch to the video. There we go. Okay. Thank you very much. And it's a very simple design. Okay, it has a solar panel on it, so it's chargeable anywhere. You slip it on your finger. It has a little dial at the side, and you put an age from an infant to a child, adolescent, adult, and elderly person with a small microcomputer inside. And all it does is it reads those observations and gives you a red, amber, or green signal. Green being everything's normal for your age. Red, obviously, everything is very distorted. So I'll just hand that round the Dragons for the moment. I'm going to leave this here, if that's okay. So what would £1 million do? So it would take our developmental prototype. We're going to be spending about £250,000 to £300,000 on this. This technology exists, it's just no one's brought it together again. What we're going to do is then take some data collection. This will be field tested in both the developed and developing world, in environments where a quick assessment can be made by healthcare professionals and non-healthcare professionals. The idea of removing the numbers is just a green light to give someone an idea about whether this patient may be sick or not sick, in addition to that healthcare professional's gut judgment. And then we have the remaining part of the money, probably the last third, for distribution and marketing. The key thing for this idea is a distribution network already exists. We have Lifebox, we have the World Health Organization to move out rapidly with the transportation and distribution of a large volume of these SATS probes. So what would £1 million do? It would give you a tool for simultaneous safety. Save lives, save resources. Thank you very much.
Sorry to keep you moving. Would you like this? Sorry.
Thank you very much indeed again. Fabulous idea.
Just really want to go straight to the finances. How many of these would you make for £1 million, and how many lives would you save for £1 million?
How many would I make for £1 million? So the first cohort of Lifebox only distributed 4,200 SATS probes. That's what they've done already. They didn't have a £1 million investment behind them. With the current cheapest SATS probe you can get, which is now looking that Lifebox have knocked down to nearly under something like, it's ridiculous, just under $18 or $20. You've got the ability to get out about 400,000 of these things quite quickly. The purpose of the last tranche of the money, though, this last 200,000, is to produce the ability to make a sustainable need for these in a local healthcare environment, because they start paying for themselves. So you ask me how many lives could these save? Well, it's not just about lives being saved, it's about unnecessary transportation and unnecessary movement of adults and children to environments where it wasn't needed. They were actually quite well and could have delayed their transfer. So that the cost of that becomes quite difficult to work out. But actually, if you just look at UK figures alone, I know in my own emergency department, and I know this is a developed country, about 45% of the children who present to us have completely normal physiology. A large proportion of them get admitted. Now, there are some social reasons behind that, but there's a lot of fear, especially in children, and we admit a lot of things unnecessarily, so it's a two-way probe. In my own hospital, we'd save £210,000 a year if we actually listened to the readings that we added to children.
Okay. So, Damien, when we look at most technological innovations in healthcare and the kind of barriers, it's not so much about the product and whether it's good or not, or the availability. It's actually getting people to change their behaviour around using it. So you talk here about distribution and marketing, but take that a step further for me. How are you going to persuade clinicians to actually utilise it? What's your strategy?
Can you put your hand up if you're a clinician or deal with patients? Okay. How many of you use these in your patients? Okay, so this is not new. Okay? I'm not asking people to do anything more than they are normally doing in their day-to-day practice. It's just adding information.
Yeah, but it's also, I'm a clinician too, but it's to trust the judgment of and kind of use that as a guidance instead of your kind of clinical judgment. And no, but I'm saying that this is reality.
Okay, so one of the things that is actually vital is that no piece of technology should override a clinician's clinical judgment. Now, I prove to you that you are all willing to make a judgment without any need for technology. Okay, what you very cleverly did is, unfortunately, you're better than the average because you predicted that last child may have actually been unwell. Okay, I go around the world showing that last clip, and a lot of people don't recognise some of the adverse features. Okay, and that's where this probe comes in most useful.
Damien, one of the big problems in the world is workforce, and I couldn't help wondering, looking at the simplicity of your device, whether very unskilled, people not trained at the professional level would suddenly be equipped with the ability to make important decisions about whether to use a resource or send a patient to help. Have you thought about that next issue?
Third part of the £1 million, that third segment, about £250,000, is a test about actually whether it's safe or not to empower a local health population who's not trained to use this. And my hope would be is actually I'd probably remove the amber setting for those groups, and you either get told green or red.
Yeah, there are 10 studies that could come with that little device that, like those that come to mind, very powerful.
Well, and at that point, I start to ask, sure, when do we let the parents do it? At what point does this become essentially a companion to the thermometer? at home. And again, maybe you set the amber level on the more cautious side, but give the family the opportunity to say, or to know, this is definitely safe, don't worry about it.
If you had challenged me that 2 years ago, I would have said, not on your life would I let a parent anywhere near this. The more I show video clips and discuss with parents about decision making, I am actually changing my opinion on what we should let parents do.
Well, sure.
Thank you.
I want to say that we think that all of these should be done. They're all transformational. Each of you individually, the idea, the thought process you went through, and the way you made the case, each of these has a chance to be transformational in some aspect of patients' lives and clinicians' lives. Having said that, as with any one of these dance contests and so on, only one can survive. And be the winner. You said to announce the runners-up first, but I can't do it. I can't do it.
Go with your gut, Dave. Go with your gut.
I never would have thought of that. Thank you, Fee. The one that we felt was the riskiest, but the most potentially game-changing by completely transforming where knowledge and ability to intervene takes place was Damien's. So Damien, you are the one who'll be going to Paris, and you better bring it back in a more developed condition next year. And to all the rest of you, our